Well, gentlemen and lady, it seems we have a case of cytomegalovirus esophagitis here. Don't you agree?
No, not really. I guess it could be, but there's also the possibility that our patient might be suffering from dermatopolymyositis.
And I wouldn't rule out hidradenitis suppurativa either. It does have similar symptoms to what we're seeing here.
I reckon you guys should consider my diagnosis as well. I'm leaning towards myositis ossificans.
Well, Frank, aren't we the cocky one today? The patient has cytomegalovirus esophagitis, dermatopolymyositis, and hidradenitis suppurativa. You're wrong, by the way. It's myositis ossificans.
Wait, Dr. Hawks, are you saying we should disregard all other possibilities?
Yes, Frank is right here. We shouldn't dismiss any of our diagnostic theories so hastily.
Since when do you believe Frank is ever right, Leslie?
I don't. I just wanted to get Hawks's reaction. Yours doesn't impress me.
No. Myositis ossificans it is. I'm ordering cystoprostatectomy for the patient, which is risky, but the best treatment in this case. This patient has myositis ossificans. I'm sure of it.
I've seen you make this mistake before, Hawks.
That was years ago, Tracy. My experience is unparalleled in this field. Trust me on this one.
Why should I trust you?
Because every night before bed I read up on cases of myositis ossificans.
Is that before or after you got a naughty proctologist violating each other with an ultrasound device?
What the hell? Where do you come up with such a disgusting accusation?
Your browser history.
I'm dead serious. It's not me who would look that stuff up.
I doubt that. Since when do you leave your computer unlocked?
Every couple of weeks when I have those stupid things you call patients to deal with in telehealth calls, and I decide to walk away for 5 seconds to let them know I'm not interested in their sob stories.
Then I suggest you look into locking that laptop up when you're not in the office, and change your password.
I've just reviewed the patient's charts, and it looks like we made a grave error here.
Grave. I'd say our patient is in grave condition, Randall.
Exactly my point. Frank, we need to rethink this cystoprostatectomy treatment immediately.
Why? The procedure was supposed to be simple and straightforward, according to Dr. Hawks. We've done it dozens of times.
I know, but there's been a misdiagnosis here. This patient isn't suffering from myositis ossificans as we were led to believe.
What are you implying? That someone deliberately misled us?
Not necessarily. But it is clear that our patient doesn't have myositis ossificans, so the cystoprostatectomy was not correct for this case.
Well, what do you suggest we do now?
We need to get second opinions from other specialists in the field and reassess the treatment. This patient's life is at stake, Frank.
All right, Randall. I don't like it, but you're right. We'll start looking into alternative treatments immediately.
That's what I hope to hear. The sooner we can get this sorted out, the better for our patient.
You fools. Your incompetence nearly killed that patient.
Dr. Hawks, we were not aware of myositis ossificans being a misdiagnosis.
We apologize for our mistake, Doctor. We will be more careful in the future.
We understand your frustration, but please give us another chance to prove ourselves.
The diagnosis is clear, you idiots. You don't even know what you're doing.
Dr. Hawks, we are working hard to improve our skills and knowledge. We hope that one day we can reach the level of competence that you possess.
We will make sure not to repeat this mistake again, Doctor. We promise to be more thorough in our diagnoses from now on.
Here's a suggestion. When you break into my computer to look up how to fix your mistakes, make sure you're not using search terms like nude proctology appointments.
Who the hell other than you would do that?
That's what I'm asking, Leslie. One of you clowns is trying to sabotage me, and this is one of the few things I will put my foot down on. I do not abuse the hospital internet to look up sick shit like that.
Have you tried locking it or setting a not easy to guess password on it?
Yeah, not to mention, none of yous would have time to use it.
I can buy that excuse from Randall and Leslie, but not you, Frank. Watch your ass.
Screw you, Hawks. I never would do that to you or anybody. I doubt these two would either.
Just watch yourselves. Non-suggestively, please. No, I'm going to get lunch.
So, how's your day been? How are those patients doing?
The one I've got today. I'm not sure yet. We're trying to figure that out still.
Anything else on your mind?
One of my asshole doctors has been looking up not safe for work material on my laptop, and I haven't figured out who yet.
That's odd. That sounds like the behavior of someone you used to work with forever ago.
Really? Who was it?
I can't really say for certain. I'm not sure I remember their name or what they look like, but I feel like there was somebody on your team who frequently did stuff like that.
Whatever. Anyway, I've got a patient to fix. I'll fix my doctors later. Bye. Wake up, clowns. Myositis ossificans was a dead end from the start.
And what makes you so sure?
He doesn't even have his protective gear on.
I told them he's too reckless for this job. Too impulsive.
You'll see. I've found it. X-linked recessive hypoparathyroidism. It's the new diagnosis.
And how did you come to this conclusion?
How did we not catch this? We're doctors, for crying out loud.
This is a disgrace.
You're a disgrace. I will find out which one of you is screwing with me later.
None of us are. We're professionals. The last place you'll find any of us is in that repulsive bed of yours. Now get lost.
It doesn't matter now. We've got our solution.
What's the prognosis, Hawks?
The patient will live. They'll just need constant monitoring due to the severity of this disease. You're right. I screwed up royally with the diagnosis.
Well done on finding the correct one, though. That's what matters most.
Yeah, if only I had less idiotic doctors to work with. They never listen to me anyway.
Are you still blaming them over your browsing habits?
Of course I am. Of all the things I will boast about, that is not. I know what incognito mode is. Whoever did this to me is trying to get me in trouble with you. I don't need help with that. I do that just fine on my own.
So what are you going to do now?
Whatever I have planned, I'm not sharing that with anyone. Not even Dr. Hugh. We're going to play it day by day as normal until I catch the bastard.
Who would want to sabotage you?
Who wouldn't? What a stupid question. I'm not coming in tomorrow.
That's fine. Where are you going to spend it?
Wouldn't you like to know? I'm simply gonna lay low and maybe you'll figure out how to get security working in this hospital so I can stop being sabotaged.
Oh, whatever we'll do without you tomorrow. At least Randall seems to know what he's doing around here. Every time you're gone, things go smoothly.
Maybe it's you. Maybe it's him. But even though I won't be here, I will be watching.